Hi, and welcome back to 10 Kids, 2 Docs. I'm Sylvia.
I'm Vivian. Welcome back. Today's topic is bedwetting, one that we talk about all the time because it is very common, and it's also referred to as nocturnal enuresis in the medical community.
All right, let's jump in.
Welcome to the 10 Kids, 2 Docs podcast. Seasoned pediatricians and longtime friends, Sylvia Bank and Vivian Carlin have counseled thousands of parents and are raising 4 and 6 kids, respectively. Join these doctor moms as they incorporate fun and their combined wisdom and experience to share parenting insights for anyone looking for practical and trustworthy guidance. Please note that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment from your doctor.
So, why don't we start this episode off by defining what bedwetting exactly is?
Yes, so technically, by the definition put out by the American Academy of Pediatrics, when we talk about bedwetting, we are talking about age 5. Because it's so common for children 4 and under to still not be dry at night. That the mechanisms required to stay dry at night often don't kick in until those ages. And at around age 5, we see a lot of kids staying dry overnight, but still a percentage that are bedwetting or having accidents overnight. And
Right.
that is as high as 20% or so at age 5. So if you and I have 10 children, then we should have 2 between us that were bedwetters. So did you have a bedwetter?
I did. I had a bedwetter. What about you?
Okay, I had 2.
Okay.
So we're hitting 30%.
Right. Which is not uncommon.
Yes, absolutely something we talk about all the time.
So, do you have any specific stories you'd like to share about your experience as a mother of bedwetters?
Well, first of all, one of my bedwetters was the very classic deep sleeper.
Mhm.
And that is not universally true of bedwetting. I know people think of it that way, but that's not always the case. This was definitely that child who could fall asleep so deeply and the brain would not wake them up to go to the bathroom when needed.
Yeah, my child that was the bedwetter is also a super deep sleeper, and he will often comment that his sleep is like Minecraft sleep, where, when you're playing Minecraft and when you go to bed, it's instantaneous and then you wake up, but time has elapsed in Minecraft world. And he literally describes his sleep as he puts his head down and instantaneously the eyes open and it's the next day.
Honestly, I think having that skill lifelong is so worth wetting the bed as a school-age child.
Absolutely.
My other bedwetter was different. This child was also kind of in a classic category of born prematurely, which can delay the development of all of those pathways that have to be working together to stay dry overnight. Also, that child had a little bit more tendency towards constipation, which can definitely increase the frequency of wetting the bed as well. I
Yeah.
will say both of them did outgrow it. So one of them was closer to the age of 9, I think, and the other around 8.
Us too. Like our strategies wound up being so good that I actually don't really know when my bedwetter outgrew bedwetting. So one thing that we invented in our family, I coined it the princess and the pea, was that we would have on the mattress, I think every parent probably has this, the fully plastic layer over your mattress that completely zips up, right?
Yes, yes.
And then on top of that would be some sort of sheet. And we're not talking Pottery Barn Kids or, Ralph Lauren. We're talking, you know, um, Walmart sheets, Amazon Basic. So we'd have the plastic layer, Amazon Basic sheet. And then on top of that, we would put another plastic layer, but just a fitted sheet plastic layer.
Mhm.
And then we would just layer plastic with regular cloth sheet, plastic, regular cloth sheet. So it was multiple layers on the bed, like the princess and the pea, except they're not mattresses.
Yes.
And then at night, if there was an accident, which at this point, because they're not in pull-ups, it's not every night, the child could wake up, realize that they're wet if they do, and then they could peel off, the sheet and the plastic layer, have a readily made bed for them to get back into, obviously change their pants and jammies and climb back into bed and go back to sleep, taking care of the entire overnight wet bed process without having to wake up their parents.
Yeah, this is brilliant. I
Yeah.
love this, Sylvia.
And it also gives them that sense of autonomy as well, that the same sense of I'm taking care of this. They don't need to tell anyone. They are getting older and getting more responsible. They can take care of their overnight issue, even if they don't know how to put a fitted sheet onto the bed, right?
Yeah, totally. I love this. I did not go that far. Of course, I had the plastic zip sheet as the bottom
Mhm.
layer and then would just have a sheet. And my child would just need to know, hey, if you wet the bed at night, this is after we're out of pull ups, and it would still happen occasionally, of course. You need to pull that sheet or at least tell me. And then I, had that wet sheet and could just Lysol off that plastic layer and then, put on another sheet. So, but I
Right.
love the Princess and the Pea. That's brilliant.
Did you have any other tricks that you used with your kids?
So I work at a overnight camp as the physician on staff every summer. And as a result, my children come with me. When my child came at age 7 and was still occasionally wetting the bed, I was concerned, how is this going to go down at camp? And I realized many kids wet the bed every night. And
Mhm.
overnight camps are set up for that scenario. They have systems in place where the cabins are checked when the kids are not there. And they have a whole laundering system where all the sheets are collected from beds that were wet, they're washed, they're put back on the beds while the kids are not there. In other words, it's such a common occurrence.
Right.
And one of the tricks I learned from a developmental pediatrician who advises kids who have, more prolonged issues with enuresis or with wetting is to use an absorbent pad that's made for adults, specific to men and women, and then use like tight fitting underwear, not boxer shorts. So you place the pad in there and use that overnight in addition to wearing something like sweatpants, not like thin pajama pants. And so I did have a child that I would send to camp that way, and that child would have their own trash bag in their bag in case they needed it. They could completely dispose of everything without anybody knowing, and were wearing clothing thick enough that nobody would know. So I opted to do that to get them to camp.
Yeah.
Then otherwise, my philosophy was really just time. We're just going to wait this out until all of those mechanisms develop to come into place to allow you to be dry overnight. And then once I was seeing that consistent dry, a week stretch or so, then I would switch and we would go into underwear.
So the other trick that I used, especially when we went on vacation, is sometimes they would pretty much almost make the night, but then, if they slept too long or whatever, the bedwetting would occur. And that would be like an extra wake in the middle of the night. Oftentimes, the children are going to sleep before the parents. So if I wanted to ensure dryness, then when I went to bed 2, 3 hours after my child did, I would just bring him out of bed, have him void just one more time before I went to bed. And then that would be his bladder capacity would be enough to be able to be dry that night.
Yes, this is a hack that I do discuss in the office. It does decrease the number of accidents. It doesn't tend to like long-term train them, but it is buying you time for them to just get older. As we
Mhm.
know, time solves this problem almost universally.
I was definitely the waited out. There was no real concern or need to do any intervention.
Yes.
And I mean, I think as a pediatrician, very comfortable knowing that it's normal.
I was very much the same. We'll just ride this out. It will eventually go away. There's no rush. It's not a sign of any neurologic problem or problem with the bladder or anything significant. Of course, for my child who had some intermittent issues with constipation, I made sure that was taken care of. But otherwise, it was just, let's just wait until this resolves.
So we've had a great discussion about our personal experiences, tips and tricks with bedwetting. Now I want to move on to talk about how your pediatrician can be involved and what sort of advice they can give you in the office.
So, Sylvia, when a child comes in with bedwetting, I know one of the first things we want to do is make sure that there's not some underlying medical issue that we're missing. So, why don't you just briefly talk about that?
Um, Oftentimes, the first thing I want to establish is that the bedwetting isn't a new phenomenon, something where they had been dry for a year or so and then all of a sudden started wetting the bed. Having accidents like that can be a red flag for potential urinary tract infection. Sometimes they can have a yeast infection, or very rarely, it can be an early sign of diabetes that doesn't want to go missed. When that history comes up, I will collect urine in the office and do some quick tests just to rule those things out first.
And thankfully, a simple urinalysis in the office is all we need generally to make sure everything looks normal.
Right. And secondly, I go through a little bit more of the daytime dryness, where we review if they have accidents during the day, what their patterns are. So we talk a little bit about daytime dryness as well. And finally, we review constipation, which can affect bedwetting.
The way I think about it is that there are three different systems that have to work together to allow a child to achieve nighttime dryness. And the first one is the bladder needs to have the capacity to hold urine overnight so that it can be released all at once in the morning. And anything that's impeding that space will cause a higher tendency of bedwetting. So the big one that we see is constipation. So
Right.
I'm always asking about constipation. And sometimes parents don't even necessarily know that there's constipation. So if they don't know, then I ask them to be on watch. Watch that your child is having one soft stool every day or every other day. If you're seeing hard balls in the stool, then you know that there's constipation and that might actually be contributing to the bedwetting. Having that space at the bladder is one. The second is the kidney, and there's a natural increasing release of antidiuretic hormone overnight, which allows the kidney to produce less urine overnight. And sometimes that system needs a little bit more time to become sophisticated enough to be enabling that mechanism of less urine production overnight. And then the third one is the brain, which I alluded to with my deep sleeper. The brain needs to be triggering the person to wake up at night to go to the bathroom when they have to go to the bathroom. So while, yes, the cliche is that deep sleepers wet the bed, that's a subset. It's not everybody, because it's all of these mechanisms working together.
So mentioning it to the pediatrician is never a bad idea. I've actually seen bedwetting emerge in a patient who was suffering from seasonal allergies that we recommended non-sedating antihistamine like Claritin or Zyrtec, where they weren't wetting the bed before. But once they started taking the antihistamine, even though it's supposed to be non-sedating, it was sedating enough where they were sleeping deep enough where they were no longer waking up overnight to use the bathroom. And then bedwetting started after that.
Yes, I've seen this too. So when I'm talking to a parent about bedwetting, I'm going to address any dysfunctional voiding during the day. I'm going to address any constipation and manage that. And then I think about the things we can do and options for how to manage the bedwetting, with the idea of this is a joint decision that involves how motivated the parent and child are to do something about this, because there's always the option on the table to just continue to use some kind of overnight diaper or to continue to change sheets and just wait for it to resolve.
If it's infrequent, like every other week, once a week, that's one thing. But if they're experiencing more than half the nights with wetness, then usually we move on to just having some sort of absorbent undergarment for ease of management. And they do make diapers up to size 6. And pull-ups tend to be a lot less absorbent than an actual undergarment or diaper. So if they're leaking through the pull-up, if the sheets are still wet through the pull-up, then oftentimes I will tell them to go back to an absorbent diaper. And even for the older child that's bigger, they can move to adult undergarments as well that are quite absorbent.
It will come up as to whether or not leaving a child in diapers overnight is inhibiting the feedback loop of encouraging them to wake up at night because they're feeling that wetness and waking up. But for the majority of kids, the reality is that they are not waking up. They will wet the bed and they will continue to sleep with the wet bed. As we have to take into account, this is significantly easier and more convenient, especially too when you have kids that are sharing rooms. It's less embarrassing for them. So that concern that you are delaying the outgrowing of bedwetting is a misnomer, and that it is okay while they're still having that frequent wetting to leave them in some type of absorbent undergarment, pull-ups or the thick training underwear overnight.
And as they get older and they're still wearing an undergarment, I like to encourage parents to transfer some of the responsibility over to the child, where in the morning, the child can take off their undergarment, dispose of it in the proper receptacle, and clean up and wash up as part of their self-care.
I totally agree. Like so many things in parenting, we talked about this in the picky eating episode too. The idea of transferring responsibility to your child as much as possible is really valuable. And also, while we're on behavior, I do discuss with everybody, I know you do too, Sylvia, just general behavior modifications that we can do during the day to help decrease that nighttime wetting. Some of this is common sense, but trying to encourage the child to drink the majority of their fluids earlier in the day, to limit any fluids 1 to 2 hours before bedtime, to avoid caffeinated, high sugar, high salt drinks and snacks in the evening time, and of course, to make sure that they're avoiding right before they go to bed. And then, as you talked about, another thing that often helps decrease those wet nights is if the parent is motivated to wake the child up a couple of hours into that nighttime routine, wake the child up, have the child void, and put them back to bed. After all of those things have been done, the two things that we talk most about in the office for people that want to go even further are alarm therapy and even medication, which is DDAVP. So why don't we take a look at each of those as well?
Well, the first one is a bedwetting alarm. Did you ever use a bedwetting alarm?
I never used an alarm. Did you?
Okay. No, we didn't use one either. But occasionally I will recommend the alarm in the office, and it requires some explanation. So the bedwetting alarm is a sensor that the child puts in their underwear. And as soon as any moisture is detected, it completes the circuit, and a very loud, blaring, noise making alarm goes off. And sometimes the mere sound of the alarm, they will wake up, they'll stop voiding, and then use the bathroom in theory.
Yes.
But sometimes what winds up happening early on is that the alarm is going off and the child has wet the bed and they're still sleeping.
Yes.
So sometimes at this stage, the way that it has to be implemented is the parents hear the alarm going off. They go to their child's room and wake them up while the alarm is still sounding. And then they change and then they go back to sleep, setting up the alarm again in the underwear. Eventually, the child will hear it and then take care of themselves on their own at night, to that point where once it feels the first drop of moisture, the alarm goes off, the child wakes up, the child voids, and then they go back to bed dry.
I think it's one of those things where it's a decision based on the parent's motivation to do this, as well as the child's willingness to do it and readiness to do it, because it does require work on both parts. They're very effective, but I do tell people, I mean, we're talking effective in that 3 to 5 month range, not necessarily a week. And like you said, it really is an investment of time on the parent. Is
Right.
that a good time? And are they motivated to do that? Or do they just want to see what happens over time?
So the next thing that we sometimes do in the office is to prescribe a medication called DDAVP.
DDAVP is a medication that is usually given by a nasal spray. It can also be given by a pill. And it causes the body to reduce the amount of urine that is made overnight. It only lasts for that one night. And it doesn't have any lasting effect as far as training the child's body to not make urine at night. It's used in specific settings. And there are a number of reasons why people might do that. So you mentioned travel, I mentioned overnight camp, overnight sleepovers. These are all very reasonable options for using DDAVP. I personally, with my kids, never used DDAVP, but I've certainly prescribed it for patients. How about you?
Yeah, I've prescribed it, and it comes with a caveat. It doesn't always work on everyone.
Oh, this is a good point. You're right. I'm just looking at the Bright Futures Healthy Children website right now, and their stat that they give is that it works in 40 to 60% of children.
Yeah. And then I definitely caution the parents to watch the excessive fluid intake after the medication is given, because if the body is not regulating the fluids, you can overload it with DDAVP on board.
Yeah. Yes, that's right.
And I also definitely caution parents that it's not to be used every day.
Right. The scenario in the office when I'm most frequently considering it is in that older child, that preteen, maybe even early teen, who is still having bedwetting and is very responsible and motivated.
Yeah.
We haven't really talked about percentages, but let's do that. So, we said up to 20% wet the bed at age 5, and
Right.
then that drops pretty steadily. So by age 7, we're generally down to
10, 15%.
Yeah, 10% or less.
Mm-hmm.
And by age 12, we're only at 3%. And I have learned from my urology colleagues who I've asked about this, even if at age 12, they are still wetting the bed, by the time those children go through puberty, almost universally, they outgrow that. So there's a lot of things that happen that mature the body and the brain during puberty. Yes.
Sometimes I see in the office when we're discussing bedwetting, there's a lot of parental anger and shaming of their child for bedwetting. And, I highly discourage this. And hopefully, we've outlined how it is beyond the control of the child to set the stage and let the parents understand that it's a very common phenomenon for kids. And removing that shame or embarrassment from a physiologic issue really helps overall your child's psyche, later in life as well. We've reviewed both our personal experiences with parenting bedwetting, our recommendations as pediatricians in the office. Now let's move on to the summary of all of our thoughts from today's episode.
Okay, so first off, bedwetting, very, very common. It is not something that your child can control. It is something they will almost universally outgrow. So like with so many things in life and pediatrics, time is almost always curative. We just don't know how much time. In the meantime, there are things that we can do. We certainly want to make sure they're voiding regularly during the day, going to the bathroom. We want to address any constipation. And then we want to encourage the child to drink quite a bit in the morning, to limit their drinking 1 to 2 hours before bedtime, avoiding any caffeine, salty snacks, sugary beverages at that late night time. For parents that are able and willing, waking your child up when you're going to bed can certainly increase the chance that they'll be dry on that particular night. It is very reasonable to keep them in pull-ups or diapers until you see stretches of days where they're staying dry. And then for that parent-child combo that are really motivated, alarm therapy is certainly something to discuss with your pediatrician. And DDAVP is an option for those unique times where they're spending the night out and want to make sure that they're not wetting the bed.
And we do encourage transferring as much responsibility to the child as they get older, taking care of their undergarments or taking care of their sheets, empower them and ease the stress of having a bedwetter at night. I can think of several episodes that we can do based on our discussion today. Constipation.
Sure. It could be an episode at many different ages, actually.
Yes. Daytime wetting, what to do if your child is having occasional daytime accidents, and tips and tricks and what to discuss with the pediatrician there.
Okay. Well, this has been really interesting, Sylvia.
Yep. This is 10 Kids, 2 Docs. I'm Sylvia.
And I'm Vivian. See you next time.
See you next time.
Thank you for listening to 10 Kids, 2 Docs, hosted and created by Sylvia Bank and Vivian Carlin. If you enjoyed this episode, please subscribe and recommend our podcast to other listeners. Visit our website at 10kids2docs.com, where you can find links to social media and leave comments or suggestions. Back next week with more topics in parenting.